Each week on At Issue, we have an in-depth conversation with a key player involved in the 2024 legislative session. This week, we speak with the Speaker of the House, Jason White of West. Speaker White, thanks for joining us on At Issue.
Thank you. It's great to be here.
So I think the focus, the spotlight heading into the session was Medicaid expansion, the question of if and how. Reporting from Mississippi Today last week laid out the Senate's potential plan to address this. Reluctance to call it Medicaid expansion, but it does make more people eligible. It does draw down federal funding. So, where is the House positioned on this? We know that you made a change with the Medicaid committee with Missy McGee. She has been an outspoken proponent of some type of expansion. What can we expect to see from the House?
Well, I'll just say this. We'll talk about the House plan. As to the Senate plan, I have not seen a plan. I have not seen a bill. I think the Lieutenant Governor's made some generic statements about he supports it. I don't even know if they have the votes in the Senate to pass any sort of expansion product or whatever you want to call it. We've been focused on that for the better part of 6 months and certainly into the fall while I was still, of course, campaigning for Speaker. There seemed to be some consensus around we were willing to look real hard at this situation and look at low-income working Mississippians that aren't covered, have no coverage. Either they don't make enough to afford their own or the jobs that they fill, the employer doesn't provide it. And so that, us being one of the most unhealthy states in the nation, poor, all the things and factors, and we could debate and talk about reasons and things for that, but it's no denying we're an unhealthy state. So when you factor all that in together with the labor force participation rates that we see hovering barely above 50%, I think we need to do everything in our power, number one, to incentivize work, but number two, the folks that are working, let's try to keep those folks healthy in the workforce and out of our emergency rooms once their conditions have exacerbated to the point of, they've got some chronic things now going on that if they'd been addressed with just regular, normal health care,
right,
might have been prevented, so to speak. So I think it makes sense. Most Mississippians see it as the federal government pays 90%, the state shares 10%. We have health care providers that are stepping up and saying, hey, we're willing to help the state pay that 10% portion. Most folks are centering around this. They believe this to be the right thing to do. And so as Republicans, I think Mississippi's prospered for 12 years under Republican conservative leadership. I think the one area that's fair for critique in our leadership has been we have not addressed this issue. And so I was determined if I got a chance, we were going to address it.
And it's interesting you mentioned because your stance on this is a departure from past leadership. So, when you mentioned campaigning for Speaker, was it a very targeted decision on your part to bring this potential solution to the healthcare crisis to the forefront, to the top of the conversation as you kind of tested the waters? Well,
as we began to see problems around the state with our hospitals, particularly rural hospitals, that started driving this conversation a little bit. But I want to be quick to point out, this will not save some of our rural hospitals. They're going to have to change the way they do business. No question about that. So I'm not putting forward covering these working Mississippians through Medicaid as a way to save rural hospitals. It won't save all of them. This will go a long way to paying for some of the uncompensated care that they all provide, while it will also make our workforce healthier and more able to show up for work every day. I think that's important. And again, we're talking about mostly working Mississippians from age 19 to 64. That's a lot of people. It could be as many as 200,000 people in Mississippi. I think it's time for us to have a real conversation and figure out a way to do this at little or no cost to the state. I think you'll see something that will have a work requirement. We'll ask for that in the form of an 1115 waiver from CMS.
Okay.
Now, if they don't grant our waiver, I think we're prepared to move forward with it and have this segment of the Medicaid population be in a managed care setting with MCOs, managed care companies that will manage their care. They're going to monitor the work requirements. If you're not working, are you looking for work? Are you full-time student gaining skills and necessary things that would put you in a better position to compete in the workforce? So we're going to work hard to see that those things are addressed. And it's, there's 122 members in the House, 79 are Republicans who campaigned on a conservative platform. But part of that platform is doing what's best for Mississippians as a whole. And so you're going to see a conservative spin to it, maybe different than what some other states have done. But at the same time,
could there be something like a hospital tax?
Yes, there will be a provider tax either through our managed care companies that handle the Medicaid population or through our hospitals or some combination of the two. They have all been more than willing to come sit down at the table and say, hey, we want to be part of this solution. This is the right thing to do. Okay. And I would remind folks, again, we're talking about at no cost to the state, and just simply by covering the working poor and expanding Medicaid to those individuals, the federal government gives you an enhanced reimbursement on your entire program for 2 years at 5%. So you're talking about $650 to $700 million of federal money that would come immediately to the state. We can bank that money and use it to offset any portions of the program that are considered too expensive. I want to do it for 4 years. I think after 4 years, we have data to measure. Folks can decide the parts that are working, the parts that aren't working, and how we need to tweak it if we need to tweak it. So I'm willing to hear other people's views on it. We're tired of hearing no. It's time for us to examine real solutions.
And last thing on this, speaking of no, you mentioned the 79 Republican members. It is a supermajority. I imagine you will have support from the Democratic Party, members of the Democratic caucus in the House, for a plan like this. There is someone out there that has said no to Medicaid expansion a lot, often framing it as welfare. Do you feel that whatever you're able to put together in the House and work with the Senate, if something were to come to fruition, that at least in your chamber there will be enough to override a veto if it were to come to that?
I think in the House you'll see probably north of 100 votes for this. And I was talking about when I was running for Speaker earlier and this coming up. Here's how it came up. As my colleagues were campaigning for re-election in Republican primaries, for the first time voters were saying to them, what are y'all's plans on health care? What are you going to do about these hardworking Mississippians who have no coverage? Because they know somebody in their family, maybe the particular person they're talking to is in that boat. And so it started being real for them as they were on people's doorstep asking them to vote for them. And so that's when the conversation started coming back to me about, hey, we got to get a plan together. We've got to address this. And so sure, the governor, has been against traditional Medicaid expansion, and he has not been quiet about that. And certainly he's entitled to his opinion. And, he's won however many statewide elections he's won, that's that many more than I have. And so with all due respect to him on the issue, I think folks can be for Tate Reeves for governor and still have a common sense approach to how we cover the hard-working Mississippians who are in that low-income category below 138% of the federal poverty level. So I don't think those things are exclusive. Like, I think you can be for Governor Reeves. And I'll also say this. I've been having conversations with him. He is reasonable and is pragmatic in his approach. Remember this fall, he helped his Medicaid team come up with a plan to get an enhanced reimbursement for our hospitals.
Right.
To the tune of $600-700 million annually. That money's in the same bank account that this Medicaid money's in. That's not like a different pot of money that's somewhere else. It's all taxpayer money in Washington. I'm simply saying, as that was a piece of the puzzle, this is another very important piece of the puzzle. And that work was applauded by Republicans everywhere. And I think you're going to see more businesses come forward and the business organizations of the state come forward to say, this is something we're on board with. And as all of that happens, I think a fresh look at it, I think we can present it in such a light that the governor can hopefully support it.
All right. We'll shift a little bit, talking about Medicaid expansion as a way to extend health care coverage and access to the working poor, to maybe less served or underserved communities. The Mississippi Adequate Education Program, kind of in the same vein, attempts to do the same thing, make sure that underserved or unserved places get some of the resources and the accessibility. It's a big question. I know it came up last year, the funding formula, it hasn't been fully funded. How do we address this as a state? Is it completely, revamped formula? Is it, committing to funding it? So all that in mind, what is the House going to do about MAEP? What's the House position or the House strategy when it comes to education funding?
Other than the healthcare piece, this is where we have spent all of our time. I put some of our smartest people in the chamber in the House, particularly on this issue. As you know, we had a change in our chairman in education, so they're fresh faces there. We are going to come forward with a formula rewrite. We will move away from MAEP and come up with a new model that is student-centered. It will have a base student cost and then have particular weights to that student, not to that district, not to past funding at any particular district, and not at the teacher units, the things that MAEP chases in the way that it tries to come up with this magic amount. And again, we're not reinventing the wheel. Our sister states around us have done this. Tennessee just did it. It's more fair. It's more equitable. It's what MAEP was supposedly designed to do, but it had an artificial catch in there, that 27% rule that propped everybody up to that point. I say that weighs heavily into what I'm calling true fairness and equity in a funding formula. And what's going to be interesting to me is to see, as we unveil this, it cuts across party lines and regional lines, and it's going to make for maybe some strange bedfellows when it comes to politicians figuring out maybe they've normally been against a formula rewrite in education, K-12 education, and this one actually helps their people. So they're going to have to make a decision. Do I go with the standard talking point of MAP is great, anything else is bad, or am I going to look at the facts and say, this is better for my district and it addresses the exact things that I say I'm here fighting for? Now, let me say this. That's going to come with a lot more money. Okay. We're going to be willing to put our money where our mouth is. And we've had some hold harmless over the past few years as it relates to particular school districts that have either lost students or changed. Mm-hmm. We're going to get out of that over about a 3-year period. We're going to give a 3-year phase in to get out of some of that, and at the same time get to a more equity-based model.
So I hear you talk about being student-centered, and you mentioned places like Tennessee. It sounds like you're setting up something that's going to be at least a stepping stone towards school choice. Is that the intention here, to set up a funding system that allows money to follow students?
No, the only way, money can only follow students in Mississippi through what I'm calling our ESA program, and the way that we've done that with children with a disability or some other things. I do believe you will see what we call a portability piece that allows students to transfer from their local public school district to another public school district that will accept them, and the home district won't be able to hold them anymore against their will. Now, they've got to get that other district to accept them, and certainly accept the state portion of the student cost, because that's all it'll be able to transfer. We're not going to transfer the local part of the money. It'll stay in the home district. So there will be a portability piece, but it won't necessarily take flight in this new formula. That's just another piece of our ed reform. We think if parents and kids want to be in a different school district, the home school district shouldn't be able to hold them against their will. Now, we're not forcing them on anybody. That other school district have to be willing to accept them. I do think you will see some push, at least in DNF districts, for students and the state portion to be able to go wherever they want to go. Now, the politics are tricky on that with our state's complicated history of race and public school and private school and all of those things. I'm not trying to whitewash any of that. I acknowledge that. Okay. I'm just saying this is about giving public school students, especially in poverty-stricken areas, some sense of choice where their schools have chronically failed over time. Now, folks would argue they've chronically failed because they hadn't had the money. I would say when you look at per pupil spending across school districts, more money doesn't always equate to better results. So much of it has to do with poverty in the home, so many other factors that have nothing to do with the amount of money that's spent in that school district.
Okay.
But that's not the thrust of the funding formula rewrite. Nobody can understand MAEP except the 10 people that wrote it. And you're always chasing this fictitious number. That's not what we should be about. We've put historic levels in education the last few years, and we'll do it again this year. Now, we don't get a lot of credit for that, but I would say Mississippi spends about 50 cents of every tax dollar on K-12 education. I think that reflects a huge priority.
And you said you put some of your smartest people on this. What role have teacher organizations, educational organizations had in this formula, this new formula?
Well, certainly we love our teachers. I was raised in a teacher household. My mom taught public school for 35 years in Kosciuszko, English, I might add. And so I grew up in an English teacher's home every day. I don't know what role teachers play in coming up with a funding formula. I think parents will like it. I think, and certainly, we've had historic teacher pay raises the last few years. So I would say we put our money where our mouth is on that. I think MAE is going to really like this formula. And so it was interesting. They put out a white paper with their legislative priorities, and one of them is a formula rewrite that truly reflects equality and equity across all regions and places. So I think they're going to like it very much.
Okay, and a short answer on this: do you envision this rewrite that you're going to present in the House as when it's all said and done, will it reflect an increase in ed spending?
Yes.
Okay.
A significant increase.
Sticking with education, but elevating up to past K-12, there's a bill to revamp and expand the Mississippi Tuition Assistance Grant, the MTAG. Proponents say that there's going to be an additional $30 million of it that the state is going to invest in workforce development. That is, it kind of expanding it so there's adult learners for part-time enrollees. It's being characterized as workforce development. I mean, do you agree with that? And is there a place in the House for something like this?
I think there is a place for it. The devil's in the details of that. We're going from about a $10 million spend to a $40 million spend. As you rightly point out, it's a $31 million increase. And so what that looks like, how much money can we afford, and what does it really do? To the workforce piece, that new formula rewrite that we're going to push has a significant weight for career tech and workforce training in our K-12. So we hope to weight our funding formula and give career tech a real weight there. As to the MTAG stuff, everybody's kind of trying to figure out how does it hit my institution. Like I noticed some of the reps that represent areas where our four-year universities are, they're looking really close at how does this affect the people that come to my school. And so, there's been an attempt the last 2 years, I believe, maybe 3, but I know the last 2, to redo MTAG. And last year it got real confusing. I remember Representative McGee, who represents Hattiesburg in that area and Southern Miss, she thought it had a detrimental effect the way the that version last year was. And so ultimately, after all that confusion, that bill died a painful death. So it's back with more money, and usually a lot of times, money solves lots of problems.
Right.
So to answer your question, I'm not sure about that. IHL and community college hadn't weighed in with us about where they are on that. Typically they will. I am aware of the bill. It's Representative Scoggins, I believe, has that bill. And,
that's correct.
I have referred it to universities and colleges.
Which is Representative Scoggins' committee, is it not?
That's correct.
Okay.
That's correct. And he is from Jones County and is heavily involved in their community college there. So he gets it from that standpoint. And we'll see. From
the perspective of the four-year institutions, seeing this expansion of the funding, but also seeing the expansion of who's eligible. I mean, on the surface, it looks like it's geared towards talking about adult learners, part-time people. Those are people that are probably leaning more on community college education, workforce training. So is that where their trepidation is coming from?
They hadn't told me that, but I suspect that's what it's going to be. But I will say this. We want to really put an emphasis on our career tech and workforce training. That seems to be where we're making some strides in Mississippi. Nothing's wrong with a college prep, high school diploma, and folks going to a four-year university. I'm just saying we have true good paying jobs available in Mississippi that are more along the career tech path. And so for folks that are willing and want to go that route, I want to provide opportunities like this, opportunities for them to gain that skill so that they, are productive citizens and in our workforce, and we get that labor participation rate up. And so any thrust to increase and change MTAG will be in the vein of, does it create more opportunities for students that lead to a better trained, more skilled workforce, that would help improve that labor participation rate? Because everybody, lots of smart people are working on trying to figure out what is the cause of that, what we can do to improve it.
And is there any, thinking again, taking the perspective of the four-year universities, this is a program that's kind of designed to help get people to the, that might not traditionally been able to get to the four-year university there. is there a detriment to them? Will this kind of be unbalancing, those opportunities?
I don't know. Again, that's going to be the trick in that legislation is folks deciding who the winners and losers are. And typically folks don't like it when we pick winners and losers around the Capitol. They would rather other folks besides politicians do that. And unfortunately, as you know, that happens on a daily basis.
Yeah, it does. So winners and losers. That kind of is an interesting way to kind of get to this next point, which is the income tax. I know when it was first rolled out a couple years ago, Representative Lamar and Speaker Gunn rolled out a massive income tax elimination. It was a loser; it didn't go anywhere, but over the years since then, we've seen some kind of, reduction of the state income tax. Now we have some data on the effects of that. As you well know, the last fall, the Legislative Budget Committee wasn't able to agree on a revenue projection because there's some questions about revenue. Early revenues are down. What has this kind of killed the fervor on a further reduction or elimination of the income tax, or is there a more pragmatic approach to this now?
I would say there was always a pragmatic approach. Here's what I would say. Revenues are slightly down from last year, but they're still going to be almost $1 billion more than we spend in our state budget. And so as long as we're taking in $1 billion more than we're spending, you're going to continue to hear Republicans talk about ways we can cut taxes and get out of your pocket and let you spend your money. You know better how to spend it than we do. Now, having said that, we have major issues. We're talking about spending more money at education.
Right.
We're talking about PERS, even though nobody really wants to talk about it. We're talking about that.
And they're going to be potentially asking for an infusion of funds themselves.
Not potentially. They are asking. They're asking for a major cash infusion. So I'm saying you do have those things to think about. And I want us to be adults and have real conversations in the room about what we can do and what we can afford. So we've still got 2 years left of the phase in of that first income tax cut that we passed just whenever it was, 2 years ago now, I guess, 3 years. It's still to be phased in. So while the clock is ticking, we're still peeling off that to get to the 4% flat tax. And I believe we have 2 years left on that. So I feel like we've got a little time. I know that is high on the governor's radar to continue that cut. And I see that the Senate has dropped a bill to cut the grocery tax. I do not see how they replace that revenue for cities. That is how cities fund their local governments, is with the diversion that they receive on the sales tax collected in their cities. And so if we're gonna pull the rug out from under our cities, we've got to have some sort of replacement. In that first bill that the House passed that you alluded to, we actually cut the grocery tax in half, but we kept the cities whole, which made it kind of like a double hit to the state. So we were giving up our half of it, or our 3/4 of it, and the rest of it, we were letting the cities keep all of the diversion so that they were made whole. And so that gets tricky, several $100 million that goes to fund those municipal governments. I think you will continue to see a Republican-led legislature talk about ways of cutting taxes when we're taking in way more than we're spending.
And to be fair, when we hear things like taking in more than we're spending, I'm just going to give one example of where maybe skeptics might question the governor declining the summer EBT program, federal funds coming in, the state just pays for the administrative costs, and apparently the reasoning for that was that we don't have the money. So when skeptics hear we take in more than we spend, and we hear things like, well, we can't afford that, I mean, what's your response to that?
Well, I can't speak to the governor and his decision on that summer program. I do know the cost was minimal to the state, so I can't answer for him, and so I won't attempt to. I would say we feel like we're funding at pretty robust levels. We put historic money in education last year. Our workforce training is up. We spent an extra $100 million last year on our hospitals. We spent a lot of money, and so I don't know what gives. I know there are things that, look, we have not done well in the mental health space, and with our child protective services, those things take money. Obviously we've been in lawsuits on those things. Child protective
services is kind of coming out under the umbrella of human services, and they're going to need money to kind of fund this reorganization.
They are, and we are preparing for that. And those things take money. Certainly they do.
Last week, I was House Minority Leader Robert Johnson was sitting where you were sitting, and one of the things I asked him was, you have a supermajority, but Democrats have their policy priorities, things they're going to fight for. What are one or two things where you see the most bipartisan support when it comes to? I mean, we've talked about Medicaid already, but to talk about getting things done where there should be a seamless path for some of these things.
All right. Robert and I meet on a regular basis, and surprising to lots of folks, we're actually friends. Our wives like each other. We go to dinner, and maybe part of that's we're lawyers, and so we have, we can sometimes put differences aside and just enjoy each other's company. But certainly they want to do something in the healthcare space. We want to do something there in the House among my Republican caucus. So we're along the same lines. Might his look a little bit different than ours? Maybe, but I think we agree on 85% of it. And, 85% of anything at the Capitol, I consider a winner. And lots of smart folks do too. So we got that in common. We have agreed and continued to work on restoring voting rights and suffrage to individuals who've committed nonviolent crimes. Chairman of our Constitution Committee, Price Wallace, is working with Check Taylor and some others in that space. Some of Robert's head caucus members on that particular issue.
Well, on that, I'll
so
say
those are two big issues.
He said last week he was expecting a clean bill, and he didn't get a clean bill.
Well, sometimes people don't like the sausage-making process around the Capitol. And, Robert said he expected a clean bill on the ballot initiative too. But, again, I would say 80% of what somebody wants around there is a pretty good day. Okay. And no matter what Robert told you, he knows the truth.
Okay. So I hear ballot initiative, and I'm sorry, I hear disenfranchisement. That was a big thing. That was a big thing. I know that was a big thing coming out of coming out of the Capitol last week. The charge that you kind of laid upon those two committee chairs to draft up something. And
they're looking closer. They're not just paying lip service to it. They're looking and trying to find ways to find common ground to advance something this session.
Was this? I mean, how much does or has the last two big federal cases regarding this does that inform this decision at all, or is it looking at the electorate and participation rates or even just the kind of the archaic nature of those provisions?
I think it's the archaic nature. I mean, you're looking at one of the crazy Republicans who helped lead some of our criminal justice reform over the last few years, allowing for expungement of some crimes so that folks can go back to getting a commercial driver's license and be gainfully employed, and some of the things that, we do a terrible job on, and our recidivism rates are not very good. Now, I'm not blaming that on our prison system. I'm just saying about half of Mississippi inmates, when they leave our custody, are back with us in about 18 months. So we could do better there. So things like expungement, things like restoring voting rights. If a guy or girl has gotten out of prison, they've served their time, they've paid their restitution, we want to restore them. We want them to be productive citizens in our state. And it's not too much to ask. If they've done all the things and checked all the boxes, it's not too much to ask to restore those rights. So we're trying to find ways and common ground and work hard on those issues.
And my mistake earlier, when we're talking about the reenfranchisement, not the ballot initiative. That's the one that Leader Johnson said he expected a clean bill.
He expected a clean bill. He did not factor in 79 Republicans, that want to have their say on that issue.
Of course. We've talked about a few things, and I'll just leave this open to you. I mean, what else that's coming through the House that you have your eye on, that you're prioritizing, that we haven't talked about, that you'd like to throw out there?
Well, we talked about all this money a while ago, and we didn't mention MDOT and a dedicated stream of revenue. Now, that's something that they've talked about for a long time. The issue is finding that money. And again, we're talking about lots of money. They've asked for an additional $650 million annually, and our budget's about $6.5 billion. So they've asked for a 10% increase of what the state budget is overall just for their budget. I'm not saying we don't need it. I'm just saying we've got to figure out what we can and can't afford. There are potentially new streams of revenue with our online sports betting, which the House passed that bill
Correct.
2 weeks ago.
Yeah.
I'm anxiously awaiting action by the Senate on that. I don't know what the holdup is, but, their politics maybe get tricky down there. I don't know. All casinos I talk to are very much in favor of it. As our sister state, Alabama, considers going all in on gaming, I think that's one area we could improve. We could expand our base, so to speak, in the gaming area. That would be a new dedicated stream of revenue as we pass the bill, and they estimate 30 to 50 million there. Our bill dedicated that money to the Emergency Road and Bridge Fund at MDOT. That could be redirected strictly to maintenance, which is where their big need is of up to $350, $400 million a year. We may even redirect a portion of the use tax. We send 15% to cities and 15% to counties, 5% to state aid for bridges. We may dedicate an additional 15% to maintenance, which would be about $150, $200 million a year. Right. So that doesn't get them all the way there, but it gets them about halfway there. But again, that's a large hit to the general fund budget.
Yeah, it's a large pot of money, and from the conversations that I've either partaken in or heard, it's this dedicated stream of funding, this elevated dedicated stream of funding, has to do with having to play catch up a lot. From what I understand, though, that roads and bridges were neglected so long that we're beyond just the maintenance part of it. We need to get to repairing and renewing before we can get to true maintenance. So is there a plateau? Are we thinking a couple years ahead where we do reach a plateau to where, okay, now we're maintaining and we don't have to dedicate so much to getting us there?
That is their plan. And I will say this, they have a good long-range plan that prioritizes maintenance over here and what they call capacity projects, which are new, widening a 4-lane like in DeSoto County to 6 lanes where that traffic is so heavy up there, or things on the Gulf Coast, different ones. Incredibly expensive to do those kind of projects. We're still running a highway system on an 87 highway program that taxed gas the way it did. It was not put on an index, and it was not a tax. It was just per gallon. So whether gas is $1 or $5 a gallon, you get that 18 cent. We need to look at that. And I don't know what that entails, and I don't know where we go with that. And here's another thing. As we've built that system on that gas tax, cars are more fuel efficient. They last longer, and we have the electric vehicles coming on. So all of that needs to be looked at as we figure out how we're going to fund our roads going forward. It's tricky. Inflation has hit on those things, and a bridge that used to cost $10 million now costs $40 million, and it's incredibly expensive.
All right. Well, that's quite a number of topics. Speaker Jason White, thank you so much for joining us on At Issue, and hopefully we'll talk to you again.
Very kind. Thank y'all for having me.